So, Hilary, I know we've not been physically in the same room before, but I regard you as a friend. I regard you as a fellow pioneer in this whole movement for change with integrative medicine. Why does integrative medicine matter to you?
Elizabeth, I think that integrative medicine matters to me because of its huge potential, what it
Um,
brings in terms of a more expansive approach to medicine while still sort of taking the best of conventional research-based, evidence-based medicine out of both arenas, conventional and complementary. I love the potential that it brings to health and healing for pediatrics, especially.
Mm. And you've been working in this field for some years now, and I wondered if you might tell us your story because my understanding is you've now got board certified training for pediatricians in the States. That is something I feel the UK is very far from. So tell us how it began and how you've got to this incredible point now.
Sure. As I think with most people that I've met in this field, it started with a personal journey. For me, as you know, I come out of the world of pediatrics, and then I'm fellowship trained and board certified in pediatric emergency medicine. So during my medical training and my fellowship training, we were placed into situations over and over doing very tough things to children, and you're working with families in very fraught situations. And I remember walking away thinking, is over and over, is this really the best we can do for these children and families? And it wasn't that the medicine was bad. We were taking excellent care in the conventional sense of these children and families, but it was the pain, the stress, the fear,
Yeah.
and thinking, what more could we do? And not only for the patient, Elizabeth, but also for ourselves and the healthcare team, as well as just taking care. So how were you feeling walking out of a procedure, suturing a screaming child, or as new professionals came on board in the United States, there is a degreed program called Child Life. And so during my fellowship training, that was coming into being. And suddenly you would be working. So let's say you're doing a very difficult, complex laceration on a young child, and then add in such a gifted healthcare professional up at the top of at the head of the bed with the child who's, reading a book, who's blowing bubbles, who's singing a song. And I'm looking around, I'm like, what's happening? What's happening up there? And the child is completely away, just distracted in their beautiful, calm, easy place. And the parent has relaxed. All the healthcare team has relaxed. I have literally since been in situations where everybody in the room, including myself, who was doing the procedure, was just quietly singing Christmas carols or singing funny songs.
Wow.
And it just brings this sense of joy, fun, and ease. So when that came into being, I began my sort of intellectual curiosity about the mind body medicine, the mind body skills, the mind body tools. And that set me off on a journey of exploration into learning more about this area, which led me to fellowship training myself and other studies along the way. And the other thing that happened too was that one of my own children became ill, and seriously ill. And so I then started calling on other skills, respecting and using all the conventional tools, but also bringing in the additional tools that I was learning about to help my child, but also to help myself regulate and deal with stress and help me move through a very complex situation more effectively. So very, very personal. Yeah.
Yeah, it was both work and personal, and as
Hmm.
I listen, I hear a beautiful natural compassion and empathy arising from you. You know, you're taking in the whole picture, the whole room, everyone matters to you. You're probably, very well primed to extend those skills. But then we have that kind of personal experience where we realize this matters,
Yeah.
how my child gets through this serious condition. We're going to need a lot of things in the picture here.
Absolutely, and I think being open. I mean, I am a very conventionally trained medical
Mm.
scientist. I have gone down the sort of the straight road in Western medicine in the United States at really, really wonderful institutions, and I consider myself incredibly grateful and fortunate to have had this medical training. And at the same time, to be able to learn how to assess the different options and to be open minded to bring these into care. And certainly nothing, I would never use anything on another person's child that I wouldn't use in my own family or on myself.
Right.
That's always been a metric that I've used as I analyze different options. So, yeah, it's been an important and very interesting journey.
And I guess it's you, in terms of a position of authority, and, you've gone through, as you say, that very conventional training
Yeah.
has allowed you to influence the status quo in a positive way. Tell us a bit about the training of other pediatricians and how you set it up and how it's evolving.
Sure. I started this program that I started, the educational, it's the Academy of Pediatric Integrative Medicine. I started it very deliberately because of the gap in deep integrative medicine training in pediatrics. So it wasn't that the other training was lacking in any aspect. It was that I wanted to really narrow and go very deep in pediatric training, and the evidence was accruing. So had been sort of thinking about it and looking at the field, and I thought this is the time. This is the time. There's a huge demand from parents. There's a gap in pediatric specific medical training. And so I just began to move forward from the evidence base, really starting with the strengths and developing courses based on interest and where the evidence was strongest, and built out a program, primarily for physicians to train them. And I partnered with the University of Arizona College of Medicine for the continuing medical education credit. So it's a category one, level AMA, a very, very robust training, which I do because that brings a sort of reassurance and relief to the physicians who are coming in.
Mm.
So it's a very rigorous evidence-based training focused on gap areas for physicians, and we've since expanded there are two programs. The Scholars Program is primarily for non-physicians, affiliated team members, nurses, advanced practice, practitioners, APPs, we call them here, psychologists, dietitians, social workers, to build out the healthcare team. And then we yet last year got the national approval for the fellowship training, which then positions the physicians to be board eligible. And we have our first group of physicians who are preparing to take the national board exam in just a couple of months. It's incredibly
That's
exciting.
incredible. So that means that those clinicians will then deliver integrative care into mainstream medicine. Is that right?
Oh, absolutely. And students that are coming to learn in this curriculum and in this program are unbelievable. They are so accomplished. I have the most respect for these people, and they are moving into programs, big academic pediatric hospitals. They are also beginning their own practices. There's a wide variety. There are pediatric subspecialists in ICU, in pediatric gastroenterology, and pediatric heme oncology, as well as in general pediatrics. And not only are we training students in the United States, but also we've had several, and in the current class also, who have gone forward to begin programs in other countries. For
Mm,
example, we have a graduate who set up and is running the first integrative hematology oncology pediatric center in the country of Chile. It's
mhm, mhm.
beautiful, changing medicine with each patient, with each decision, putting up a center. We have trainees in South Africa, in Mexico, in the Netherlands, all around the world, which is so exciting.
It's so exciting,
Yeah.
and you and I have been interested in this movement for change for many decades now, but I feel we're really watching it happen now, and we're
Mhm.
just recruiting for the next cohort of our master's program, and I've already met, 4 incredible clinicians. All but and the question I wanted to ask you is, I feel that they're younger and they want the model now. They kind of want to adopt a broader model now. They're fed up with things that are too narrow and don't acknowledge complexity. I just wondered if you're seeing that as well, like a thirst for it.
Oh, absolutely. And very interestingly, in the past week alone, I've been in contact with one faculty member who was a former student and one current fellow who's leading change at an academic institution in the United States, both asking me, I want to, and I'm getting real interest from my trainees, so medical
Yes.
students,
Mm,
residents,
mm.
their own fellows in their subspecialties. Um, can you help me put together a program, an introductory program for these learners? And I think absolutely, I think and I think it's correct for the field. I think the earlier that we bring this to these learners, uh, who are, we love evidence. We love evidence. We're careful. We're working with children.
Mm.
We're very evidence based here, and so I think the earlier we introduce this into medical training, the better for everybody. Not just the parents and not just the children, but for the trainees. 100% yes.
I agree that issue of safety is paramount, but I've also been really grateful that you've invited me into your program to teach about homeopathic medicine, and
Hmm.
that might be one where the evidence needs more scrutiny and is more challenging, although there is a lot there. But what's great about your cohorts is that they seem very open to learning about approaches that are really broadening the field of integrative medicine.
Yes, and I think also because they are conventionally trained physicians just like me. I mean, they come in, and I think the fact that every course, every lecture, every distinguished lecture that we bring in, the faculty are amazing. Everybody is referencing, we're in the National Library of Medicine. We're referencing studies, and we're finding the edge of the evidence and discussing it. Here's what we
Mhm.
know. Here's what we don't know. How will we approach this tool? What's the level of risk or safety? So I think it's a very intellectual process with a huge heart to it. So you're just trying to navigate the waters carefully.
I love that. It's an intellectual process with a huge heart to it.
Yes.
I think that's you as well. But so I wanted
Thank
to
you.
ask, I wanted to ask from our viewers and listeners, yeah, just can you describe an area of pediatrics where integrative medicine works particularly well, or where perhaps it was a forerunner of other areas that now work?
Yes.
Mm.
Very interestingly, I think that the world of mind body medicine has been a leader in pediatrics in part because it is relatively low risk.
Yeah.
You would steer away from it in a child who has obvious trauma, post traumatic trauma or sexual or abuse or physical abuse, neglect. You would partner with a mental health professional. But overall, I think that the field of mind body medicine has really moved forward well in children, especially, for example, in pain, in gut associated, functional abdominal pain or irritable bowel, these areas, or chronic constipation, where you can bring in tools that build the child's sense of self-efficacy, that gives them, for example, gut-directed clinical hypnosis, that gives them a tool that they can use to ease their discomfort, to increase their peristalsis, their gut mobility, and reduce stress-associated symptoms. So, in my reading of the literature, that's been an area that I've really been paying attention to because
Brilliant.
of its efficacy as well as its flexibility. It's used in pediatric ICUs, it's used in pediatric clinics, it's used outpatient. Kids can use it at home. Kids can implement these skills at school. For example, if there's like test anxiety or stressful situations. So I love this field especially, and it's easy for kids to learn these skills. So I would
And
say
you
that's a standout for me.
Yeah, we'd be kind of hypothesizing maybe that stress in the autonomic nervous system might be impacting. So, what would gut directed hypnosis look like for a child? What would they be learning?
Yes, absolutely. So a practitioner can work with the child and find the most sort of important words or the most important approach. In clinical hypnosis, as you know, the person is not under the control of the practitioner. The child or the person receiving the hypnosis is really directing the process. So that's an important point to make. And so, as the person is talking with the child, you would be wanting to understand, how are you feeling? How do you describe your discomfort? What color is it? What shape is it? What intensity is it? What do you think is the best way to address this? And so we're creating a script so that we begin with relaxation, and then we focus on the area of discomfort, and then we're using their words. Maybe it's a sharp pain. Maybe we're softening it. What does it look like? Oh, it's like a knife in my stomach. Well, let's see, how can we change that? What would help that? What would soften that? What color is that pain? Oh, it's bright red. It's so uncomfortable. Let's see if we can lighten that color. Can we change that shape? Can we soothe that area, in a sort of a child, age appropriate, developmental appropriate language? And then all of a sudden they are in charge. They are relaxed, they are in trance, they are using their own words and sensations and modifying them to help themselves. And these sessions can be recorded on phones, they can be used by the child, they can be implemented whenever they need them. So that's just one example. It invokes imagery, it invokes sound and taste and sensation. All the senses can be looped in. So it's incredibly powerful. You're using so many parts of the brain.
Yeah, and it reminds me just how wonderful the brain is, but also our understanding of pain in general and realizing that descending control and ideas, seem to be really vital. And I guess that would lead us on to integrative medicine in chronic pain in
Yeah,
general.
yeah.
Would there be other approaches, integrative approaches, along with mind, body, and hypnosis that you would be teaching and training clinicians in?
Absolutely. So, especially in chronic pain, depending on the areas. There's a nice body of literature, for example, in biofeedback in
Mhm.
pediatric chronic pain. There are so many kinds of biofeedback, and it's become more sophisticated. So you can loop in biofeedback almost with it's almost like a video game, and kids can quickly move into this sense of mastery of, for example, lowering their muscle tone or cooling their skin or slowing their heart rate, slowing their respiratory rate using biofeedback, which is a very enjoyable, fun way to do it. So that's one thing in chronic pain. I think acupuncture really also has some
Mm.
very interesting applications in pediatrics, in pediatric chronic pain, and also acupressure for children that are worried about needles. However, I have to say, I have done acupuncture myself successfully in children as young as 6 who were living with chronic pain after very serious burn scarring, sort of a recovery mode after acute burn. I think yoga also has a nice accruing literature for pediatrics and is
Really?
being used in chronic illness. Yes,
Wow.
so there are a variety of tools, and you'll notice that, I'm not reaching early for necessarily a dietary supplement or another packaged item. I
Yes.
think in pediatrics, we're really careful about, really knowing what is in the bottle, what's in the bottle, what's in the
Mm.
supplement, what's the source. And so typically, although we're educating about the world of dietary supplements very carefully, it wouldn't necessarily be the first thing that you would reach for in a child, especially if you were treating a chronic condition. So I might go for looking at an anti-inflammatory diet. I would absolutely look at how do we build a sense of control and efficacy? How do we move the body gently and purposefully in a way that's comfortable for them? How do we build that inner strength and locus of control for the child?
Yes, because
Yeah.
it's almost like you're trying to support them to build skills which they can take into adulthood the rest of their life rather than somehow that supplement or pill being something they're dependent on. So it
Yeah.
sounds like an incredibly empowering model.
That is one of the most important things to me. I think circling back to your first question, why do I think it's so important? I think that's it. You want to empower, especially these children,
Mhm.
I mean, to take charge as much as possible of their health, to partner with them.
Mm.
I think that's the beauty of this approach to me.
Mm. Yes, and I guess over the years in my homeopathic practice, I would often, want to engage the child right at the beginning so that they would
Yes.
know that I was present to them because they'd get very used to kind of getting very bored while while their parents spoke to the doctor. It wouldn't be that I wouldn't turn kindly to the parents, but I would just engage them first,
Yeah.
and get them drawing or get them involved.
Absolutely. I think people routinely, myself included, underestimate the capacity of children to understand and to implement, and also underestimate how much they are paying attention. These preschoolers are
Mhm,
literally taking notes. I mean, they're taking notes on what you're eating, on your
mhm,
behavior, on your
mhm.
stress reaction, on your, how you're spending your time. I'm telling you, it's incredible how much they're picking up. And so
Yeah.
this is beautiful because you can model. You can model important health behaviors without saying a word.
Yes.
Literally, if you just how you handle a stressful situation is you're teaching not only the child but everybody around you new skills, and it's an approach that we use also in the fellowship training because I want the students to understand that they are teachers, that people are observing, that people are learning just from the changes that are occurring in them as they move through the training, and so it's very organic.
Yes, and sometimes you'll have had this experience, I'm sure many times like I have, but actually the parents are subtly influencing the child's response to the pain or what's happened or just health anxiety, and they're so alert, the children, they are literally waiting for your next. So if
Yes.
softening your voice, creating positive images or whatever, like, but at the same time remaining calm yourself. So it's very interesting because you're saying about modeling that internal space, are you, as a clinician, that you are
E
trying
e
to stay in balance?
Absolutely. I think a lot of this also comes from my work in the high acuity. I have many years of work in pediatric emergency medicine and high level acuity. And as the attending, for example, you walk into a room and there's a resuscitation. Let's say worst case scenario, you're suddenly, everyone is doing CPR and controlling the airway and serious things are happening. Well, as the attending, what I tell trainees is control the room in every way, including with your breath,
Mm,
with feeling your feet on the ground, with your communication to the team, with your movements. And so if I walk in and I am frantic and disorganized and stressed to the max and I'm shouting at people and I'm not effective,
mm, mm,
the team is not effective and the patient suffers from that.
mm,
The antithesis, I walk in, it's a serious situation where the child is in trouble. Let's be as calm, effective, and efficient as possible right
mm,
now, and everybody knows their role. I'm communicating with people. I'm calm. I'm centered. I myself feel in control of my cognitive resources, my physical resources. And, we can walk out of there knowing, imagine walking out after a chaotic resuscitation versus a calm, effective resuscitation. It affects everybody.
yeah, it's a very good example because it's the idea of clinician as healer, that
Yes.
you're entering a zone,
Yes.
that you are responsible for, but responsive to.
Yes.
And I saw, terrible experiences as a junior doctor where
Yeah.
with the senior registrar would come in shouting, screaming. We would all kind of get very, very tense. But
Yeah.
it's also something about how we need to understand the power that we hold and how to manage ourselves. Yeah.
Oh, absolutely. I think there's a place that you sort of tap into, I think, or
Mm,
I'll speak for myself. There's
mm,
a resource area, that I can tap into that just brings me into a present state. I think
mm,
it also allows you to communicate really effectively with children.
mm,
They know immediately if you are truly there. Are you with me, or are
mm,
you not with me? And so a child in trouble or in pain and suffering is scared, and they are experiencing every level of stress, emotional, physical, all of it. And so if you are present to it and you can reassure, it might be as simple as a touch on a shoulder, I'm there, or a breath.
mm,
I find that that to me also is where the magic of the healing interaction occurs. I,
mm.
I don't have a better word for it, but it's almost an instantaneous connection. Yeah,
It
yeah,
yeah.
information is flowing in both directions if you're fortunate enough to be there for it.
Mm.
It's really something.
And can I ask, do you have your own practice, your own mind-body practice?
Oh, I use all the skills. Yes, I use mindfulness.
Mm,
I am certified and all the levels of clinical hypnosis, which I find
mm,
particularly powerful.
mm.
I
Yeah.
think be in the use of skillful use of language in the clinical setting is a real interest area of mine.
Yeah, me too.
You mentioned the parent.
Mm.
The parent, you walk into a room and the parent is saying to the child, How's your pain? The child is in pain. Do something." Rather than inquiring of the child, how is the pain reacting? I expect it to be easing soon because we have given you a really powerful medication that's
Mhm.
going to help you. And the child is like, "How stressed out should I be?" So the language to me is has driven my interest in clinical hypnosis, especially. But I
Yeah.
use mindfulness. I'm learning about compassion-based cognitive therapy in the world of trauma. No, I'm continuously learning and training, and it's benefited me personally hugely in my life and in my work.
I think that's what I love about integrative medicine as well, is that I'm learning all the time and benefit. I was teaching in the master's program about the placebo effect, and early on in my career, I trained in hypnosis and neurolinguistic programming. But we were looking at some of the data where the medication is given, either saying this might not work or this is a really powerful medicine, it will work. Both medicines were placebo. It is quite extraordinary how important it is what we communicate alongside any intervention we might recommend. But I don't feel that that's really taught routinely in medical
No.
school.
Oh, quite the opposite, especially in pediatrics.
Mm.
For example, going in for an injection, yeah, and everyone is like, "Okay, okay, get ready. This is gonna hurt." Uh, you know, I mean, you literally hear that over and over, and I've been working in my work to shift
Mm.
the because we have really nice tools now that are distractors, that you can use, and so I'll often say, "Okay, we're gonna do this, and you can do this." And you might feel a buzzing, you might feel a push like this, you might feel a little pressure. Some people feel a little tickle or a zing. I wonder what you're gonna feel. I don't
Mhm.
know. Let's see. Or I love saying to
Mhm.
kids who are, getting maybe have a broken bone or whatever. I wonder how fast this medicine will work for you. The child in the other room thought it was really good and it helped really fast. So let's see how it works for you. You let me
Mhm.
know when you feel better.
It's
I mean,
beautiful. It's beautiful, and, we've had 2, we call it A&E in the UK, you call it ER, but we've had 2 A&E doctors, and often people say, "Well, how could you possibly apply integrative medicine in that acute setting?" But hearing you speak, I feel like I'm in there with you as you attend, a child, and how important is all of that? The whole thing can de-escalate in minutes.
yeah, and I agree because it seems sort of like this oxymoron, integrative
Mhm.
medicine and acute care. But I think to myself, how could you not? You know,
Exactly.
I have been in situations where I was doing a spinal tap on a
Mm,
very, very anxious teenager. Of course, the family didn't want any sedation, because of the dangers and additional risks and whatever. And so we're faced with an anxious parent who's anxious not only about their child. Here we are in the ER, worst case scenario, and we are also avoiding any type of sedation whatsoever. Then we have this anxious teenager who's, like in trouble, doesn't feel good anyway. And then I've got an anxious resident, an anxious nurse, and an anxious myself. And I just thought to myself, and this is a real case. I was at the threshold of the room, having been informed that the parent didn't want any sedation. And I was like, Okay, you walk in the room and the stress levels are to the ceiling."
mm,
And I literally started a hypnotic script right then for
mhm,
everybody in the room,
mm,
the child, the resident, the nurse, the parent. and we're breathing, and I didn't say, "Okay, now we're gonna do clinical hypnosis." We were just very calm and orderly. We had our equipment. The resident is sort of wild-eyed looking at me, and I'm like, okay, now we're sitting, now we're positioning, now we're breathing, now we're visualizing." Oh, more and more comfortable, more and more easy, and the teenager is able to, position themselves, and the parent is seated, and the nurse, as you could see the blood pressure of the nurse going down, and we just sort of gathered the energy and were able to move through the procedure. But this, I was leaning heavily on all my skills in that particular, I don't think you could have just walked in and said, "Okay, everybody, just relax." No, it was very much a build up to
Uh,
a successful
yeah,
procedure.
and what's
Yeah.
amazing is probably people would say, "Oh, Dr. McClafferty didn't do anything." Like, all of that would have been kind of
Yeah.
unconscious. And just to say, I was at a European conference, in integrative medicine, and just what reminded me is listening to a music therapist create the same
Yes.
calmness with a family whose father, I think, was dying, and the children were hysterical, and
Yeah.
she played this cello, and everyone was weeping in the room, but
Oh, yeah.
essentially what she was doing, I think, was calming the whole room, the whole family with this beautiful cello.
And the staff as well, right?
Mm, yes.
We bring in the fellowship training, I bring in an unbelievably accomplished music
Mm,
therapist in a series of visits, and the research on music therapy is so amazing. The
mm.
fMRI studies that we're getting now of
Oh,
what's
really?
happening in the brain with the music therapy, it's so good, it's so powerful. So I bring this friend and colleague of mine who just happens to be an incredible music therapist changing the world of music therapy, and they begin and they bring their usually he brings a guitar, he also sings,
Mm,
and within 5 minutes of the session, all these very accomplished physicians, and we're online, we're doing this in a Zoom
so
room. Everybody is just quietly weeping as they relax and tune in to their, whatever it is they're accessing internally. It's so powerful. It's so
mm,
instantaneous. And we love music therapy and pediatrics. Yeah, and
mm.
that's one of the things I didn't mention earlier. But yeah, I'm so glad you brought it
Yeah,
forward.
and again, it's these incredible, safe, non-drug approaches, mind body. We know that we're over-prescribing a lot of the time in children and adults, so,
Yeah.
that's again what I loved about integrative medicine is there's always something there in the
Yeah.
toolbox that you could call on that could be useful.
Oh, it's like a beautiful buffet, and you never know exactly what's going to resonate with the child or the family, and it might be different from time to time. Yeah,
Mm,
I mean, you just never know, and I think that's one of the fun things and one of the reasons to continue to learn in this field is because not only is the research advancing, but you want to have a robust skill set to offer
mm.
and to encourage families to experiment and children to learn more. Yeah,
Yes, and I was always, affected by clinicians who might say to one of my cancer patients, "There's nothing more to be done."
yeah,
And of course, there's always something to be done. And with integrative medicine, you've got an awful lot. And it might not be your skill set, it might be a colleague. So then you've got
yeah.
even more skills that somebody could benefit from. So not unrealistic hope, but just the idea that things will move and flex and you need different things at different times.
I think so. I think actually the ability to offer hope. And again, we're not lying to people. We're not presenting unrealistic, but the ability to just present hope, to
Mm.
offer hope, to talk about hope, to
Yes.
frame it in any sort of way that's appropriate in the situation. I am telling you, that is one of the first things that we teach, the importance of that. And it's so powerful.
Mm.
Yes.
And sometimes to name despair and how that can manifest in different ways, and just looking at how to gently and compassionately unpack those, because children have the weaker ego, so they will lean towards a stronger ego. And if
Yeah.
that storytelling is what they can't do, then that starts to create deep distress, doesn't it?
Absolutely. And I think, too, the ability to sort of navigate very difficult situations for the physician, for the healthcare practitioner, yeah, that skill of learning to offer hope or generate compassion rather than be, as you know, in deep suffering with the patient.
Uh,
This is a modulating factor for our own well-being, our own way to negotiate a difficult specialty while not burning out or becoming really disabled ourselves by repeated exposures to difficult situations. So I have found these skills to have been critical to my own ability to move in and out of these difficult situations in medicine without harming myself really in a
yes.
emotional
Yeah.
fatigue or other, way, just to be able to stay healthy.
We were looking at some of the research comparing empathy and compassion, and how they're two
Yeah.
different things, and just being able to have that awareness of not diving in and staying in someone else's pain, but being able to honor it and see it, but without being in it, is a very, yeah, very important.
It's so important, and what I love is that now, the modalities are able to show us in the brain imaging. I mean, you're literally tapping into different areas of your brain
Mm,
with compassion versus deep empathy, only empathy in suffering versus
mm,
generate. And it's really it's so important for people who work in healthcare to I think master this and understand this concept and believe it. It's one thing to say, "Oh, I want you to learn how to offer hope." And it's another thing for a physician to be able to say, "I understand what you're saying. I'm internalizing this lesson. I understand the importance of it, and I have some skills that I now can use for myself and for my patients." It's a process. It is important to teach it as you're doing because people don't know. They don't know this
yes.
information. They don't know it. A lot, I mean, some do, but a lot don't. And
Yeah.
I think that the more it's addressed, the more, I mean, it's a vital area.
I think it's vital, because if you've got a model that's encouraging you to widen the circle of concern, go deeper, you have to give people the understanding of how to manage themselves long term. We're in these jobs, aren't we? 10, 20, 30, 40, 50 years now, with
Yeah.
people wanting to work into later lives. So look, our conversation, I could go on and on, but it is coming to an end. Is there anything else that you'd like to share before we finish?
I think just the fact that the patients are asking for more. And I
Mhm.
think that it's very important for healthcare professionals to remain open. Even if you don't use these types of practices yourself, I think the importance of receiving the patient's curiosity or the family's curiosity with respect and openness is probably the most important thing. So I continually return to this idea of more education, be open, educate, and learn. So I guess that would probably be my biggest takeaway today.
And what I hear from you is a deep respect for the children you meet, the families. In other words, presuming that there is a lot they want and need, if we understand, rather than going into the room and telling people things. We know what you want. We know what you need. Let's tell you. And that
Yeah.
model, I think, has been there. And this is, like, I feel this is, a very different model that you're offering here, which is beautiful.
One final point I would say to build on what you just said is I'm in listening mode,
Mm,
and that might seem initially to slow me down,
mm.
but it's so efficient. It's efficient because I'm receiving your information, and then I'm bringing my skill set to help you, and it's very efficient, I think, and,
Mm.
that would be maybe another takeaway. I'm always in listening mode.
I so agree with you about that, because
Eh,
if you listen enough, then you connect in the right place.
yes,
And
yes,
and
exactly.
if you step in too soon, you haven't understood. So wonderful. Lovely to know that you're there forming pediatrics in the USA, which as we know is a big, but not only the USA, but now you mentioned Holland and Chile and wow. But thank you deeply, Hilary, for all the work that you do.
Oh, thank you. It's been a pleasure speaking with you today. Thank you for having me on.
Okay.
Okay.